So let me introduce them to you. The far end is Adam Levine, who is Professor of Emergency Medicine and Associate Dean of Global Health Equity in Brown University in the US. But more importantly, he's the director of the Center for Human Rights and Humanitarian Studies, which has convened the annual Civil Military Humanitarian Coordination Workshop since 2017. Next to him is David Smith, who is the CEO of Disaster Relief Australia, which is a non-profit disaster preparedness, relief, and recovery organization engaging veteran volunteers and teams. David is a 34-year veteran of the Australian Army and a former brigadier. In the middle there, we have Lalita Hen Wong, who is assistant professor in Kosesat University, have I pronounced it right? A longtime commentator on Myanmar affairs. She is also advisor to the Thai House of Representatives on security and border issues. And she's also a board member of the Border Consortium, which is a consortium of aid providers to Myanmar refugees on the Thai-Myanmar border. And the two gentlemen next to me, next one is Piero Furlan. Colonel Furlan is the commander of the NATO multinational CIMIC group. Previously, he has commanded the CIMIC battalion of the group, as well as the CIMIC unit in UNIFIL, which is in Lebanon. And next to me is Eddie Maskell-Patterson. Colonel Maskell-Patterson is the current head of the British Defence Staff for Southeast Asia in the British High Commission. And among his many previous deployments, he was the lead operational planner for the Combined Joint Task Force for Operation Inherent Resolve, which is the one against ISIS, and that included humanitarian assistance. I will take just a few quick minutes just to frame the discussion for you. Each of the panelists have been given an opening question already, and my few minutes is to set the background for that first question. The discourse surrounding civil-military engagement in humanitarian affairs has changed a lot since the Oslo guidelines. Those are the guidelines on the use of foreign military and civil defense assets in disaster relief, which was first promulgated in 1994. At that time, the primary purpose of the guidelines, following the UN General Assembly Resolution 48182 3 years before, was to emphasize the civilian nature of humanitarian assistance and its grounding in humanitarian principles. Oslo guidelines were very much a you stay in your lane and we'll stay in ours prescription. Coordination was so that we would not trip over each other. In the past 30 years, civil-military interface has evolved from coordination to also finding ways to work together, where dialogue and cooperation are used to facilitate humanitarian operations and military missions. Here, I'm actually using the language of UN CIMIC, the European Union, and NATO. Many military organizations now have explicitly authorized humanitarian functions in foreign land, in addition to the long-acknowledged role in domestic civil protection. The types of civil-military operational environment now include natural disasters and climate change preparedness and response, evacuation of refugees, the last instance was in Afghanistan, public health crises, mine action, complex emergencies and armed conflicts, and UN peace missions, especially with respect to protection of civilians. I think it is instructive to recall that the 2003 Complex Emergencies Guidelines, the MCDA guidelines, on the use of military and civil defense assets to support UN humanitarian activities in complex emergencies, was promulgated at the height of the global war on terror. While the guidelines focused on support to UN humanitarian activities, There was no doubt that it was intended as a pushback to the American three-block war military doctrine and its 3D foreign policy, that is, diplomacy, defense, and development all at once, with both the doctrine and the foreign policy intermingling fighting forces and aid. The Millennium Plus 5 Summit in 2005 unintentionally perpetrated an Anglo-American Scandinavian view of the humanitarian enterprise as consisting of three major groups of implementers: the UN, the Red Cross, and the NGOs. There was little recognition of civilian governmental assets, primarily those associated with civil protection. Humanitarian action, of course, continued to evolve. There is now recognition of governments as major actors and not just as host governments to humanitarian operations. In this region, in ASEAN, the HADR approach of nationally led, regionally supported, and international as necessary puts governments and governmental assets in the center. It says to me that the HADR is seen as a governmental function rather than an altruistic civil society enterprise, which was the Western leitmotif. Outside of ASEAN, humanitarians, unlike in 1993, are now demonstrably more open to communications, dialogue, building trust, and better mutual understanding, with the militaries and the armed actors even towards some form of interoperability. The dual civilian military function in disaster response was amply demonstrated during the COVID pandemic, when domestic, and only domestic, not foreign, militaries were involved in its response in the majority of the world's countries. This year, 2025, the humanitarian sector is again at a pivotal point, following the withdrawal of the United States as the world's preeminent donor, as well as major donor countries shifting some of their aid budgets to address defense spending. The sector is currently facing roughly a 20% downsizing. And as we have heard in previous sessions, in the past few years, there have already been some major geopolitical shifts impacting the humanitarian sphere. So the navel-gazing question of what should civil military part of humanitarian action look like in the future is no longer theoretical. So the opening question, which has been provided to all the panelists beforehand, is, in light of the very real possibility that humanitarian action in the near future, that's in the next 5 years, will be very different from the past 5 years, what is the number one issue in regards to civil-military relations that the humanitarian community must coalesce around so as to maximize the chance of someone caught in humanitarian crises and disasters receiving the help they need? And why these issues in particular? So I'm going to start with Adam first, and we're going to just go down the line, and this is totally at random as to who gets to go first.
Thank you so much, Catherine, and thank you so much for the invitation to be here today. So as was mentioned, I'm an emergency physician by training, and I spent the first part of my career working as a clinician in a variety of humanitarian emergencies all over the world, including the earthquake in Haiti, the civil war in Libya, refugee crises in South Sudan, the Ebola epidemic in West Africa, DR Congo, Haiti again, and various cholera epidemics in Bangladesh. And during that time, started to understand that humanitarianism today, or at least then, was a lot like medicine 50 years ago, based more on anecdote rather than evidence, and also with a lot of really well-meaning people who were thrown into it, but without proper professional training or opportunities to have proper professional training. So I founded at Brown University in 2019 the Center for Human Rights and Humanitarian Studies, in order to expand this evidence base, to develop training pathways, and to really help build a community of practice. And one of the programs that we created and has really become a focus of our work was our program in civil military humanitarian coordination, It was noted as an area that was especially devoid of evidence, especially about a decade ago when we got started with this. And each year we bring together about 100 military leaders, UN agencies, humanitarian NGOs, and academics from all over the world, Global North and Global South, together for an annual research symposium and workshop on civil-military humanitarian coordination, which we hold at Brown University each May, and really gives us an opportunity to help expand the evidence base and also think about how to put it into practice. My remarks today are going to focus on one very niche area, and this is in response to the question that we were posed to come up with one specific thing, and I'm going to talk about civil-military coordination in public health emergencies specifically. And this is an area that we've been doing a lot of research on over the past 8 years, and I'm going to try and condense it into 8 minutes for you. If you aren't familiar with the term, public health emergencies go by a lot of names depending on where you are in the sector. People call these outbreaks, epidemics, pandemics, emerging infectious diseases. If you're on the military side, biosecurity, global health security. Essentially, what we have is an emergency that is caused by a biological threat, by an infectious disease, that similarly to other types of emergencies can really cripple society. And this is an area of growing importance, and the best example of this is the COVID pandemic that we all lived through. And we know that 3/4 of all the countries in the world that have militaries use them in some way during the COVID-19 pandemic. It's not to say whether that was a good thing or a bad thing, but it is a thing, and so therefore it's probably worth studying. And we did a big project, actually in combination with the Australia Civil Military Centre, and published a report last year called Considerations for Civil-Military Interaction in Public Health Emergencies. And the goal of this was to try and distill learning from the COVID-19 pandemic to look at all of the hundreds of examples we had of different militaries around the world responding in real time to a public health emergency, and trying to discern from that what worked, what didn't work, what lessons can we give for future public health emergency responses, and especially for governments that are trying to think about how they want to use their military effectively in the future, and for humanitarians and civil society organizations thinking about what is the proper way to interact with military in these types of crises. Some of this work has also contributed to the recent update of the UN SIMCORD Field Handbook and the ongoing current update of the Oslo Guidelines on the Use of Foreign Military and Civil Defense Assets and Disaster Relief, which UNOCHA is pursuing now. So the first thing I just want to mention is, why are public health emergencies different than other types of emergencies? Why do we need to think specifically about civil-military interaction in these types of settings? And there are a variety of reasons why public health emergencies are different. These are dynamic, unpredictable, and protracted in nature. Unlike an earthquake, which happens in minutes, or a cyclone, which happens over hours or days, these can unfold over months or even years. And at the beginning, it's impossible to know how long it's going to go on for. Similarly, they can start in one small geographic area and then spread to many other geographic areas, and again, very unpredictable in which way they're going to spread, which can make it really difficult for governments to think about how to allocate funding at the beginning of a response. You know, it's easy to err on either side, too little, too much, and also to think about when it's necessary to use their military. Also, when we think about the humanitarian principle of humanity, we have to expand that in a public health emergency to not only include individual human suffering, but also suffering of populations. And that suffering of populations might be in direct contrast to suffering of individuals. For instance, interventions that reduce suffering at a population level, like quarantine or isolation, for instance, can actually increase suffering at the individual level. And so these two need to be balanced. There's also a greater risk for misinformation. Now, of course, there's misinformation in every type of humanitarian emergency, but in most humanitarian emergencies, you don't have to convince people that the earthquake existed, or the cyclone existed, or that the bombs and bullets exist. People know they exist. But you have to start off in a public health emergency by convincing the public that the virus actually exists, that it's real and not made up, and that the solutions to it are also real and not made up. Victims can pose a direct threat to responders in public health emergencies. And again, that is very different from other types of humanitarian emergencies. In a conflict, the belligerent forces might be a risk to the humanitarian responders, but the very people they are working to help are not a risk to them. In a public health emergency, they can be. And this is especially an issue, surprisingly to some, for militaries, because military force protection is one of the first priorities of all militaries, and ensuring that their service members are going to be safe in a public health emergency is going to have outsized importance, greater than other types of emergencies. Also, one thing that's unique is that while many governments, many countries have legislation in place for how to use the military in response to an acute onset geological disaster, climatologic disaster, they lack legislation in place for how to use their military in concert with other government agencies in a public health emergency. And finally, public health emergencies often require a whole-of-government approach. And it can be difficult for different government agencies, such as ministries of health, education, interior, foreign affairs, and defense, to coordinate together. And if it's difficult enough for the agencies within a single government to coordinate together, you can imagine how much more difficult it can be for those agencies to coordinate with civil society organizations and foreign actors as well that might come to help in a humanitarian, public health emergency. So in this report, we identified 35 activities across 5 categories, and these were basically identified from a review of the literature of all of the different functions during the COVID-19 pandemic that militaries were used for. And then we held a number of focus groups with key informants in multiple locations around the globe to understand and to fact check sort of how militaries might or may not be used. For each of these different activities, we didn't try and say, yes, use military, no, don't use military. What we tried to give were the pros and cons of using military and some best practices from prior experience. In these 5 areas, I'm going to go through them very quickly as we don't have too much time. The first is preparedness and coordination. And some of the key factors that emerge from this is really a need for governments to create legislation at the national and/or provincial or local level, depending on how federalized the country is, that specifies the role that military will play in future public health emergencies. It's too late once the emergency starts to pass legislation. You've got to do it in advance. And also to be clear about the command and control structure. Is this response going to be military-led, or is it going to be civilian-led, and who's going to lead it, and then how is military going to fit into that command and control structure? Also, importantly, there needs to be specific provisions for data sharing. Data sharing between military and civilian entities is always going to be a fraught concept. Militaries often like to make everything classified. Civilian entities might be afraid to share data with military, and so that has to be pre-specified. And in addition to that, there are really great opportunities for collaboration around research and development, especially for medical countermeasures like vaccines and treatments for infectious diseases, where military labs and civilian labs can collaborate together, but there has to be specific government stipulations that allow that to happen. And finally, there's a huge role to play in terms of cross-organizational training exercises, bringing together civil society organizations, government agencies, and military to actually just have simulations, or as the military would say, war games, where you play out different scenarios of a public health emergency and actually how different actors would work in those scenarios so that everyone knows how to play from the same handbook, basically, before the real public health emergency starts. The second area was on public health, and in this we found that direct population-facing activities such as clinical care, vaccination, testing, contact tracing, et cetera, are probably best left to civilian health workers unless there's a real need for surge capacity in a specific area in a specific time frame. The reason for this is not even so much around trust of military actors, I'll talk about that in a second, but it's really around what military is best trained for. And the medical corps of militaries are best trained for handling trauma care. If you think about the big naval hospital ships like the Chinese Peace Ark or the USS Comfort, these are excellent tools for providing trauma care to hundreds of people at once after an earthquake, after another type of disaster. They are horrible places to provide infectious disease care during a pandemic. And in fact, most military physicians and systems are not really set up to provide care for infectious diseases in the same way as they are for trauma. On the security and enforcement side, while this might seem the most natural role for military, it's also one of the most easily abused and the one that civilian populations seem to support the least. Most important is that regardless of who's doing it, whether civilian actors or military actors are doing security and enforcement, it's important to limit border controls, lockdowns, checkpoints, and other coercive measures to the minimum necessary based on the epidemiology of the disease, not simply to have a show of force to show that the government is doing something, because often these, as we learned during the COVID-19 pandemic, often these types of activities can actually do more harm than good for the population that we're trying to serve. And then finally, the area where military is really perhaps most useful is in logistics. Military can support supply chains to get medical countermeasures, PPE, and other needed items like food to populations under lockdown, though you may want to decide whether the actual distribution at point of care should be done by civilian organizations. Air and sea transport capacity may be especially important, including for medical evacuation. And militaries are really good at facility construction, building field hospitals and other types of facilities that can be used then by civilian actors to provide care in public health emergencies. Finally, am I out of time? All right, very quick last note. Some other research that we did in this area, a number of qualitative studies across the United States, Democratic Republic of Congo, Nigeria, and the Philippines that actually produced some of the first research looking at what are the perspectives of actual civilian populations on the use of military for humanitarian response and public health emergencies, as opposed to just what we think those perceptions would be. We actually asked real people receiving aid, and what we found was a little bit surprising in some ways. Obviously, these contexts are different, and I can't generalize across all contexts, but for the most part, local populations cared less about who was delivering that aid, whether it be somebody in a military uniform or somebody working for a civilian organization. What was more important to them was that the actor was trusted, and especially that they were local. And local doesn't mean just from the same country. It means really from the same population, if they were a specific ethnic group or tribe or religious group, et cetera. And how armed actors built that trust with the local groups included, number one, ensuring security for the population, number two, speaking the local language, and number three, not violating their human rights. But in those cases, often there were many situations where even in conflict settings, like in the Democratic Republic of Congo, where people actually were much more supportive of getting aid from local militias, from local military that they trusted, even more so than from foreign humanitarian organizations. So it actually tweaks sort of our understanding of this line between collaboration in peacetime and coexistence in conflict situations, and really brings it much more to what is the perspective of the local population, and working under those perspectives in terms of deciding who is actually going to be delivering the aid and what type of activities they're going to be doing. Thanks.
Thank you very much. Okay, Dave, you're on.
Thanks very much, Catherine. And can I just start by just saying thank you so much for the opportunity to be involved in this forum. Disaster Relief Australia is an Australian domestic-focused organisation, and so to have the opportunity to come to this forum and speak to such an eminent group of people is tremendous. And so my comments in response to the question are going to be largely from our domestic experience in Australia, but I would like to think there are lessons that can be learned that have application across the Indo-Pacific from what we have learned. The second thing I'd just like to stress is that while Disaster Relief Australia is currently the recipient of a Commonwealth Government grant in Australia that's allowed us to grow significantly, we are a non-government organisation. So the comments that I'm making today are from an NGO perspective as opposed to anything more broadly than that. So look, I think there's probably a couple of elements to answering the question, Catherine. The first is, I think, for people caught in a crisis, there are two things that I think we need to do in the future. The first is we need to look at building sustainable non-military disaster preparedness and recovery capabilities. And the second one is we need to create trust-based interoperability between the military, government, non-government organisations and community actors. By doing these two things, we'll define how we move from dependency to resilience, not only at home in Australia, but I believe also across the Indo-Pacific. So in terms of building non-military disaster capabilities, which range from preparedness through to the response phase of the disaster management cycle, the default approach during disasters in Australia has been, until very recently, to call on the Defence Force. And this is because the Defence Force, like amongst many regional counterparts, brings scale, logistics, discipline and capabilities that other organisations can't. But the reality is, and this has been identified by the government in Australia, and I know many governments in the region, as disasters become more frequent and complex, and as global strategic tensions rise, this model is going to be increasingly unsustainable. That's not to say that the Australian Defence Force doesn't have a vital role to play in disasters, both domestically and overseas, particularly in response operations, and particularly in extremis where they only have the scale, speed and specialist capability required. What it does mean, though, is that the Australian Defence Force can't continue to carry the burden of extended recovery operations domestically and overseas as it's done in the past. Because if it does that, it's drawing itself away from its core focal areas, which are essentially our deterrence, readiness and defence of national interests. So when you combine that with the growing scale, frequency and concurrency of natural disasters, there's a need for a genuine alternative to the military in disaster preparedness and response. And that's where Disaster Relief Australia steps in, and I'm unashamedly pushing our barrow in this space. So we were founded in 2016, and we're a veteran-led, volunteer-powered organisation. We unite the skills of veterans, former and current first responders and civilian volunteers. Over the last 3 years, we've become increasingly recognised as a viable alternative to the Australian Defence Force in both preparedness and response operations, providing a standing national capability that delivers recovery and resilience outcomes once the immediate response phase has passed. And our strength lies in our veteran-led mindset, so we're mission-focused, adaptable and disciplined in our execution. What this allows us to do is to operate not only in response and recovery, but also in preparedness, which I think we appreciate is an area that is traditionally associated with the military. Our people know how to plan, coordinate and lead under uncertainty, and we bring that same mindset to preparing communities before disasters occur, assessing risks, coordinating with government and NGOs and helping local organisations to strengthen their own resilience. In essence, what we seek to do is to transform the principles of military service, leadership, structure, selflessness and teamwork into tools for community strength and preparedness. And in doing so, what we're able to do is not just advance civil-military cooperation and coordination in disaster management, but effectively integrate it to large part within a single organisation. The second issue I just want to touch on is around interoperability, not just coordination, but institutionalised trust amongst all actors in the disaster ecosystem. And I think everyone understands there's not one single organisation, military, government, NGO, emergency management organisations, local communities, can actually manage complex crises across the disaster management cycle on their own. The emerging Australian model, which involves the organisation that it's my privilege to lead, is a partnership by design and not by accident. So we plan alongside the Australian Defence Force, the Australian National Emergency Management Agency, state and local governments, including state emergency services and reconstruction authorities, other non-government organisations and community organisations. This planning ensures we know how to align, integrate and support one another when a crisis occurs. So when the Australian Defence Force is called in for major response operations, we are there to complement that effort. We work in parallel with the Defence Force and we take the load off them as soon as the operation transitions from response to recovery. Our approach is essentially based on four key elements. First is shared planning and communication frameworks, embedded liaison with government agencies at all levels, respect for each partner's mandate and limits, and a unified focus on community outcomes, not organisational boundaries. We believe that this approach doesn't actually blur the line between civilian and defence actors, it actually clarifies it. Defence takes a key role under the direction of relevant state or local government authorities during response when required, while Disaster Relief Australia and its partners sustain recovery and build resilience. And together, we provide continuity from the crisis into renewal. I'd just like to, if I can, Catherine, just touch briefly on just one final point. And I know both Colonel Liu and Dr Heiser mentioned innovation and the need for innovation, and I would like to think we are not responsible for the model we're using here. It actually emanated in the United States, and Adam and I were talking about this earlier, that started with an organisation called Team Rubicon USA, which then evolved into Team Rubicon Australia, which is now evolved into Disaster Relief Australia. But we believe the model we've got is quite innovative. And we think there might be an opportunity here to have further conversations about how a similar model might be used by other nations in the Indo-Pacific, but particularly amongst our regional partners. In saying that, we acknowledge the need to respect national sovereignty and understand that each nation faces its own unique challenges and requirements, and that many already have very well-established disaster management systems in place. But perhaps there's an opportunity to consider whether aspects of the model that we use in Australia might have application amongst other nations. I think it's fair to say that across the region, nations face intensifying disasters. They also have large populations of veterans and former first responders, many of whom are seeking renewed purpose. Certainly in Australia's case, these individuals are often an untapped national asset who have a reserve of experience, leadership and service ethos that can be mobilised for community resilience. So we are ready, if anyone is interested in doing this, to start a conversation with regional governments, NGOs and local organisations about how they might share our model, a veteran-led, volunteer-powered capability that builds national capacity without burdening military forces. So look, in closing, I'd just like to say that ultimately our shared humanitarian objective is simple. When disaster strikes, help must arrive quickly, effectively and with humanity. Civil-military relations are not about who leads, they're about ensuring every actor is ready, trusted and connected before the crisis begins. That's the model that we are building domestically at Disaster Relief Australia, veteran-led, volunteer-powered, partnership-driven, and it's a model we certainly stand ready to help our Indo-Pacific neighbours with should they wish to do so. Thanks, Catherine.
Where's my mic? Thank you. We now go to Ladita.
Hello, good afternoon. Are you awake? Thank you very much for bringing me here. I don't have a personal proper humanitarian training. I'm a historian by training. So I'm looking at you here from a sort of an outsider perspective, really. But yeah, like I said, I'm a historian of Burma, Myanmar, but I'm Thai, originally Thai. So I've been taught to be cautious and curious at all times. Okay, let me start by answering a very basic question of the civil military relationship in Thailand. With a special reference to the Thai-Myanmar border, because I know that some of you may have interesting questions about Thailand and its policy on Myanmar, especially on the most recent policy of allowing refugees in the 9 camps to work. Let me give you a bit of an overview of the relationship between the two sectors in Thailand. I like to begin here. In the last couple of years, we have seen more intense disasters. Some are pretty new to Thailand, especially earthquake that happened at the same time as in Burma, Myanmar. Flood crises, and more importantly, very close to my heart at the moment, transboundary pollution, particularly PM 2.5 air pollution and intoxicated rivers and soil in northern Thailand caused by unregulated and illegal rare earth mining in Shan State, southern Wa State in Myanmar. With catastrophic events like these, workforce coordination, and structure among government and non-government organizations and agencies are key in understanding how a country like Thailand handles disaster relief and humanitarianism. So first of all, I'd like to give you a case study of Thailand, how the structure of civilian-military coordination works. It's not always working, but I'll just tell you the overview anyways. So the structure of disaster management authority in Thailand is actually led by a department within the Ministry of Interior called Department of Disaster Prevention and Mitigation, or DDPM, which was only created in 2007. I just realized that when I was preparing for this workshop. So DDPM is responsible for framing broad policies mainly, such as they have a plan called Disaster Prevention and Mitigation Plan 2021 to 2027. DDPM, they have only framed broad policies and frameworks on disaster prevention and so on. But in reality, coming back to the military, there are many other agencies, especially from the Thai military sides. And when we talk about the military in Thailand, we need to separate between the Royal Thai Army, the Royal Thai Navy, Air Force, and another very important body, the Royal Thai Armed Forces. They don't necessarily get along, but I'm not going to touch on that. They're usually friendly with each other, but there are some clashes here and there that some advisors like me would know. So DDPM has 18 regional offices out of 76 provinces of Thailand. They mainly act as the coordinator, while the Army has their local offices in every province with right tools and manpower, lots of manpower. Thailand has, I believe, 300,000 soldiers of all ranks, so it's not too bad. One thing that interests me the most is the Ministry of Defense of Thailand. In Section 8 of the Ministry of Defense Organization Act of 2008, it clearly states that the Ministry of Defense, among others, shall support the government's efforts to prevent and relieve natural disasters. And you can stretch it to cover humanitarianism as well. It is common to see soldiers helping to evacuate people affected by heavy floods. And there are interesting organizations like Royal Thai Army's Engineer Department and Armed Forces Development Command taking the lead to build and repair roads and so on. Before I came to Singapore, I did a bit of homework. So I went to Tak province by the Myanmar border to interview my best soldier friends at Naresuan Force, which is a part of the 3rd Army area of Thailand. So I asked them simply about their roles in disaster relief and humanitarianism. It was them who insisted that the leading role of disaster relief and humanitarian aid is solely, it has to be led by civilians. They only get orders from the government through DDPM and sometimes the provincial authority. The Army has a leading role in disaster management. It is also reflected from their ethos now. For example, if they want to buy new weapons, new tools, new vehicles, it has to serve double purposes of disaster relief and in military operations as well. I would like to mention also that the shape and form of disasters are different nowadays, very different. They are not necessarily natural disasters, but man-made natural disasters caused by rare earth mining, for example, and irresponsible farming in areas possessed by ethnic armed organizations, sometimes, most of the time, influenced by FMI, sorry about the term, influenced by some other countries. This leads to the changing landscape of disasters where government doesn't really know what to do with non-state actors. Well, let me give you a very clear picture here. Let's say there is an illegal mining somewhere in southern Shan states. But in that area, the river runs through Thailand and it finally goes through Laos and Cambodia. So right now, there are so many rivers in Thailand that are affected by rare earth mining, for example, Kok Ruok Sai and finally Mekong rivers. So eventually, people in Laos, people in Cambodia will be affected by the arsenic contamination of the rivers coming from rare earth mining in southern Shan states. The Thai government doesn't really know how to respond to this. Like I said, this is a brand new form of disaster where non-state actors are the main actors here. We now have challenging issues, like I said before, PM 2.5 and the contamination of rivers. The Thai military is still, I'm afraid, stuck with the G2G, government-to-government approach by only contacting, talking, discussing endlessly with the government in Naypyidaw, with the Myanmar government in Naypyidaw. Humanitarian assistance of Myanmar IDPs, fleeing constant fighting and airstrikes, and how the handling of those foreign citizens fleeing from scam centers in Myanmar, fleeing from Myanmar into Thailand has also become one of the biggest problems that we have faced in the last couple of days only. So can you imagine, there are scam centers along the Thai-Myanmar border, and one day when the Myanmar government decided, oh, okay, we're gonna strike these places, we're gonna put some bombs here and there. So people who live there, who work there as scammers, they flee into Thailand. And in the last 3 days only, Thailand have received almost 2,000 people from these scam centers. And the shocking thing is, most of them are Indians. Yeah, the second are actually people coming from Africa. Ethiopia, Uganda, Rwanda, Sierra Leone. So these are shocking numbers, yeah. There was the first, it's okay. I'll come back to what Catherine had asked me about what are the 1 or 2 things that I would come up with when it comes to this theme. So I just picked up from what I heard this morning and this afternoon. I think that 2 things I like to mention here. Number one, I think speaking from the perspective of Thailand, I think Thailand desperately needs paradigm shift. And I think that we have done that pretty well in terms of legal implications. For example, since USAID and PRM, we face tremendous aid cut. The Thai government was basically forced to react and to do something differently. You know, in the last so many years, I have been talking endlessly to my friends at the Ministry of Interior, Ministry of Foreign Affairs, and they were quite upset that the Thai government did not react properly and quick enough to respond to, you know, all the problems from the refugee camps. But now, with the aid cut coming from the US and elsewhere, Thailand was actually forced to do that. So I think the paradigm shift that would lead to sustainability and the prevention of disasters, human disasters, are desperately needed, not only for Thailand, but anywhere else. I like the term resilience very much. I think that NGOs, non-government and government organizations need to come forward together to answer big problems, big questions like this. But unfortunately, in my country, the problem of coordination between different organizations still persists. They're still pretty much in the silo-oriented approach of working. And the second one I like to stress here, and this is my final point for now, is that we are, like I mentioned before, we are now facing new challenges, and frankly, we don't know how to respond to these new challenges. What would you do if the arsenic chemical it comes from Myanmar, it comes from southern Shan State, it comes from UWSA controlled area in southern Wa State, but then your government is still stuck with the G2G approach. They still want to talk to Naypyidaw, so Naypyidaw doesn't even know what to do because they don't even know how to deal with the Wa, right? So typical traditional humanitarianism, like what we have discussed all morning, I don't think it's going to work here. We need to think about something pretty gray. I don't know what, I don't want to say it here so much, but we need to come up with something to deal with this. Yeah, that's it from me. Thank you.
Thank you. Piero?
Thank you very much. Good afternoon, everyone. Ambassador Ong and Colonel Liu, thank you for this kind invitation. I think it's the first time for my unit to be present here in Singapore, and it's an honor, and I'm glad for this occasion to speak among you. I will try to bring a pragmatic slant to the table, as usually militaries are very pragmatic. I'm wearing civilian clothes just not to create barriers with humanitarians. And I will focus on mainly two elements. The first, we have heard a lot of time during these discussions, is about interoperability. And I think interoperability, following the NATO definition, is about three things. The first one is a technical pillar. The second one is a procedural pillar. And the third one is a human pillar. So, regard to the first two pillars, the technical one is related to system data exchange and the development of a sort of data assessment or the possibility and the availability of data. In this respect, there's a lot of need of more sharing of information. And of course, militaries are every time in trouble when they need to release information to the humanitarians because of the classifications of the information. But I think there are some common platforms of exchange that we can discuss later on. On the procedural part, of course, we related everything to the technical and tactical procedures and the shared technical and tactical procedures. We need more time to invest on this kind of activities, either from the civilian and also from the military side. But the very important and pivotal role is the human dimension. So speaking about human means speaking about languages, trust, mutual trust, and shared training. And when we speak about languages, this is one of the first impasses that we have in the widest community encompassing military and civilians. It's not so simple to understand the same concept without any, let's say, pre-discussion among us. So I'm in the civil-military coordination since, I think, 2014, more or less, so I have a discrete experience in this field, and I still hear from the civilian side that we are not speaking too much each other, so it means that we need to adopt a different filter during our activities and try to embed both the parties at the table when we are organizing something, when we are answering to a sort of natural disaster or humanitarian assistance activity or operation. So this brings to a lot of liaison. We need to exit from the normal scheme and understand that liaison is twofold. There is bottom-up, and this comes to this localization of the resources and the capabilities to answer in a pragmatic way to a crisis, but also from the strategic point of view, top-down liaison, because this helps to build a perfect image that helps the commanders or the people that are boots on the ground to understand what are the right things to do and in the right time, because nowadays, considering the security challenges, but also this kind of natural disasters that are rising up little by little with the climate change, we need to take decision at the speed of relevance, meaning that the decision cycle, the decision loop is very fast. So commanders and the decision makers, they need to adopt a pragmatic and a very fast decision process to have a final coordination. On the other side, you need to take the right decision, because also a little misunderstanding can create a domino effect in what we are doing and what we are bringing to alleviate the immediate sufferance of the people. The second part of the discussion is about understanding. Understanding is another pivotal keyword, because of this need for the commanders to learn more and more and to decide rapidly. This understanding is related to analysis and assessment capability. And we are very lucky because we are assisting to a sharp increase of the technology means. This means that 3 or 4 years ago, NATO was not even thinking to these high-tech platforms to develop analysis. Right now, we have the capability to develop analysis in different ways. What is the focus of this analysis is to understand the civil environment factors in order to include them in the planning or in the prudent planning that we need to adopt. And going through the prudent planning means to go through different cases and to understand how to ponder the improbable. So how to fight the black swan, which is the one that generates a lot of damages in our societies. So just a small reminder for you, the role of militaries in emergencies is a sort of third responder. Of course, there is, first of all, the governance, secondly, the international organization, the NGO system, the cluster approach, whatever you want to put on the table is never enough, and then militaries come. We need to stay out of this mental trap that we need to help everybody, because we don't have infinite means and infinite capabilities. But also, we need to understand that we are very lucky. We are living in a society that makes the whole of approach way of doing things the more and more important day by day. So we understood that we are not a sort of unique entity. We are working together. We are partnering together. If we are not partnering in the strategic level, we are still partnering people in the field, because in the field there is the need. When you have boots on the ground, resources are very finite. And so with this, I think that going through the whole of society approach, we touch the resilience part, and again, we come back to the prudent planning importance and fighting the black swan. So these are the 3 tips that I would like to offer to this discussion. Thank you.
Thank you very much. Eddie?
Good afternoon. My name's Colonel Eddie Maskell-Pedersen. Unlike my military colleague to my right, I've opted for uniform to hide in plain sight. Thank you very much for RSIS for inviting me on this panel. Genuinely delighted to be here. I've got a script and I'm going to use some of it, but I'm a big fan of telling stories. I'm from East London, so I'm actually going to start with a story. I'm going to take you back to 2001. Young Second Lieutenant Eddie Maskell-Pedersen, or Eddie MP as most people can't pronounce my last name. I was on the Spearhead Lead Element, on standby, had a pager, and for those younger people in the audience, that was something that used to beep to tell me I needed to phone a number. And I was waiting to go on an operational deployment to the Balkans. I was really excited. The energy was really buzzing within me because I wanted to deploy, wanted to get the experience that came with that. My pager buzzed, I called a number, and I deployed, but not on the operation I was expecting. I deployed on Operation Peninsula. Now, in 2001, Operation Peninsula was the UK domestic response to foot and mouth. I wasn't planning on sharing this story with you, but I thought, given some of the lessons that have been taught, I think it's really pertinent. So as a young second lieutenant, I deployed. I just recently finished our military training at Sandhurst. I thought I was a leader. I wanted to be in charge. I knew how to do military activities, and I found myself in a really unusual environment, which was not doing anything military. It It was supporting our domestic response to foot and mouth. It was providing a role that I wasn't prepared for to coordinate logistics support to our aid agencies in the UK, to our domestic veterinarians, and provide a coordination role that I just, as I say, wasn't ready for. What did I learn really quickly? I learned the importance of interagency interaction and synchronization. I learned very quickly that I was not in charge. I also learnt the importance of getting liaison officers out as rapidly as possible and to help share the picture with everyone of what was going on, because that's what the military is actually really good at. And then I'd say the final bit that I learnt also really rapidly was to develop a succession plan to extract my team so that we could go back on standby and do what the military should be doing. And I'm not saying we weren't doing the role we should be, we absolutely were, but that succession planning, allowing a locally engineered solution to take over from us was vital. So I share that story because some of the stuff that's been mentioned by our panel members, that feels really familiar, even though that isn't in a HADA or humanitarian aid situation. But it definitely felt familiar to some of the lessons extracted there. But going back to some of the comments and what's brought us here today, the world has become extremely more complicated. We heard this morning from our keynote address and from Dr. Hazer about the operational context we face, and the humanitarian need is greater now than any time since World War II. We share that view within the UK, and the dehumanising trend in recent years, the COVID pandemic, the war in Ukraine, what's happening now in Gaza, among a number of other conflicts, is increasing the complexity of the environment we face ourselves. And complexity is getting harder and harder to manage. In this context, humanitarian access is increasingly contested. Violations to international humanitarian law, politicisation of aid, and complex emergencies, and the challenges of neutrality and independence of humanitarian actors is making our environment, for what we're talking about today, more challenging to deal with. Within the United Kingdom, our lead is the Foreign Commonwealth and Development Office for responses to aid. To assist manage the complexity of this challenge, they've developed an aid memoir which includes the UK's humanitarian aid framework. This framework outlines a vision of reducing humanitarian need through prevention, protection, resilience building. It emphasises 3 core principles: prioritising those in greatest need, protecting civilians, especially women, girls, and marginalised groups, preventing future shocks through anticipatory action and resilience. And again, resilience is something that's been raised a number of times already. This approach is underpinned by science, innovation, and diplomacy, leveraging UK expertise in disaster risk finance, satellite imagery, and AI-based forecasting. Again, as just mentioned by my panel member to my right, the importance of using technology to help us get in the right place at the right time, but more importantly, predict it before it's actually happened and prepare and shape the ground accordingly. So what is the military role in humanitarian operations? We must adhere to the 4 humanitarian principles: humanity, neutrality, impartiality, and operational independence. The UK's joint doctrine publication 352 stresses that military involvement should be the last resort. As said earlier, it should be the last resort, used only when civilian capacity is overwhelmed. Coordination with civilian actors is essential to avoid undermining humanitarian space and ensure legitimacy of the aid provided. A couple of other stories then. So examples of Operation Leyland in Nepal and Operation Gritlock in Sierra Leone highlight successful civilian-military collaboration in response to aid. Operation Leyland was a civilian-military cooperation in response to the 7.8 magnitude earthquake in Nepal in 2015. The military brought unique skill sets to the disaster zone, with the majority of non-government organisations not able to replicate at ease. On Operation Leyland, military assets were required to provide detailed technical recce's of future hospital sites for the World Health Organization and engineering expertise to repair the Kathmandu portable water supply. They provided logistics subject matter expertise and provided support to the World Food Programme. All of these assets enabled aid to be provided to those who were suffering in the most need during a critical rescue phase when civilian agencies were still building their own development plan. Operation Gridlock then. This was in response to the 2015 Ebola outbreak in Sierra Leone. Due to the severity and nature of the disaster, NGOs found it exceptionally difficult to get volunteers in sufficient numbers to deploy to Sierra Leone to work in the Ebola treatment centres and associated logistic chains. Consequently, they were very vocal in requesting military assistance to help with this situation. NGOs that had never before requested military aid to support them found themselves in a situation where unique military capability was the only means of rapidly delivering support as requested. And then more closer to home, Operation Pacific Relief. This was a deployment of header assistance to Tonga in 2022. This was using one of the two Royal Naval offshore patrol vessels which are deployed, providing our persistent presence in Southeast Asia and the wider Indo-Pacific. HMS Spey delivered UK aid to Tonga following the volcanic eruption and tsunami that followed. They unloaded 30,000 litres of bottled water, 300 first aid kits, PPE, and sanitation and baby supplies to the capital. And the reason the military was asked for support was due to Tonga's strict COVID-19 protocols at that point in time. Our sailors were required to remain on board the ships, while the ships' embedded cranes transferred the goods to a logistics hub for distribution on the island's most affected areas. Other international contributions included Australia's HMS Adelaide, New Zealand HMNS Ontario, and the US Navy's USS Sampson, and Hawaii-based Matson. So I'm just going to jump through to some of our wider regional and global practices that we've learned, and then I think I'll wrap up because otherwise we won't have enough time for questions and answers. There are three areas I just want to share with you that I think are really important to this. The first one is regional readiness. So historically, the way we do this is we'll pre-position aid where we can do, or moved assets and capabilities to areas where we know there is a likelihood of some sort of humanitarian disaster. A good example of this is we pre-positioned RFA Lion Bay in the Caribbean during hurricane season to be ready to support if required. The next one, global coordination. The UK's role in the G7 Famine Prevention Compact and its support to UN mechanisms demonstrate our leadership in shaping global humanitarian policy. And then finally, local engagement. The importance of empowering national actors and local elements within the country to provide a sovereign, sustainable solution is vital to a long-term plan. I'm just going to close off with, as mentioned earlier by Catherine, one of the roles I also provided was as the Deputy Director, J5 Plans for the Combined Joint Task Force as part of Operation Inherent Resolve. My role in this was the post-liberation plan for Raqqa, one of the largest cities in northern Syria. Now, the liberation for Raqqa started on the 6th of June 2017, finished on the 17th of October 2017. I wasn't deployed in Syria or Iraq at that point in time. The planning for the post-liberation plan for the liberation of Raqqa started a year before the liberation actually started. And it started with us developing an interagency synchronization meeting with all of the aid agencies and partners who wanted to provide support to Raqqa once it was eventually liberated. Highly complicated environment due to most countries not having an embassy or a high commission in Syria at that point in time because it was viewed as a conflict zone. A lot of agencies did not have the capacity to get into country at that point in time because borders and control was restricted. And trying to understand who was the lead plan for this was exceptionally difficult. We, the military, partnered with an element called the Syria Transition Assistance Response Team, START, and we formed this interagency synchronization meeting. Again, I almost learnt the same lessons as that young puppy, Second Lieutenant Eddie MP, where I thought this was our meeting because we were the ones who provided the forum for it to start. It quickly transpired it was not our meeting. It was a director of START as an element to help with aid agency. We were providing a supporting capacity to provide a forum for aid agencies, NGOs to get together to share what the plan was and hopefully come up with a viable plan post-liberation. What really rung true to me in the first instance was the importance of early interagency synchronisation. Now, we were lucky in this organisation, in this plan, because we could choose the date when liberation started. We didn't know when it would finish, but we had some control of that working with our partners inside of Syria. But it took a year to get us to that stage. What also was really transparent is as a military planner, I assumed that all of the aid agencies wanted our protection. I assumed that they wanted the military with them to make sure they got the aid through. Often they didn't. Because they felt that it politicised them, it took away some of their neutrality, and it was a real lesson for me of working out how to work with them to allow them to do their role, but not bring them into the wrong part of the conflict. And then the final one was the bravery of the NGOs and those people who did fight to get aid through to those who most needed it. It was phenomenal. So all of those lessons I learned as a young second lieutenant still rung true, and they still ring true now. Whether it is your traditional humanitarian aid disaster relief or disaster and aid relief during a conflict zone, I think they are still as important now as they were as I learned as a second lieutenant at 20 years old. I'll pause there and hopefully we can come back with enough time for questions and answers. Thank you.
Thank you very much. All of the presentations have been just absolutely fascinating, and in fact, there are a couple of recurring themes here that I will try to bring out as part of the question and answer. The ones I've teased out is in regards to coordination or synchronization or whatever term we might want to use. Another one is on the humanitarian principles of neutrality. A couple of you have mentioned that as well. There is a saying within the humanitarian community that every humanitarian discussion ends up talking about humanitarian principles. So maybe we should just start there, even though that was already a point of discussion in the last session. I was quite struck by what you said, Adam, about having done research of the views of the population. That is very rare, as all of us in this field knows. We do a lot of research on organizations and donors, but we don't really usually ask the people what they think. And the interesting thing you said was that when you did ask them what they thought, they were actually not that averse to having military. More important part was their prior relationship and also their prior views of the military. Obviously, if they have been abused before by any of the actors, they wouldn't be that happy to have them. Now, why did that strike me? Because in the humanitarian community, there is this dogma that somehow if the population would prefer the aid providers to be neutral. You mentioned that, Eddie, about that if the civilians got too close to the military, somehow it will compromise the neutrality. Well, after hearing what Adam just said, maybe we've got it the other way wrong. That somehow it's not so much a compromising of the neutrality of the civilians. Is actually what is more important is the prior views of the population, and that's what if we're getting into this, the situation analysis that you talked about, Piero, that is so necessary. Maybe that should be part of our situation analysis to understand what the population thinks about the military providing aid, and not so much presuming that somehow if the military provides aid, direct or indirect, that it will compromise that will compromise neutrality, that somehow neutrality as a principle is so important. Would any one of you would like to comment on that?
Yeah, well, I would start by saying that, you know, neutrality is a humanitarian principle. It's not a human principle in any way. And so certainly, you know, nobody expects that beneficiary populations or civilian populations or communities are going to be neutral in a conflict that's going on in their territory. They definitely have sides that they're taking. They're also not necessarily going to be neutral in peacetime. They have parties that they support. They have religions that they support. They have ethnic groups that they support. From a humanitarian perspective, you know, I think that it is a reasonable starting point to have space between humanitarian actors and military actors until you have a better understanding of what the perceptions are of the civilian population. But if you actually take the time to ask them and to figure that out, you might find that they actually trust, you know, especially local or trusted armed actors more than they trust foreign humanitarians. In fact, that's what we found in DR Congo, is that many of the local communities trusted the local Mai Mai militias, which everybody in the conflict would consider non-state armed groups that are parties to the conflict, that absolutely shouldn't be coordinating with humanitarian organizations in any way whatsoever to deliver aid. But the local communities, that in some communities, not all, but in some communities, that's who they wanted to deliver their aid. And there were specific examples of, you know, a Mai Mai militia commander who stood in front of their entire village and got vaccinated for Ebola, showing the people of the village that it was safe and that it's something you should do. And he, in fact, was this local hero who said he was, you know, he couldn't be killed by bullets. That was the theory around him, or the fame around him. And he said, I can't be killed by bullets, but I can be killed by Ebola. And so that's why I need this vaccine, and so should you. And that was very helpful in terms of getting the population vaccinated for Ebola. And they trusted that commander because that commander was providing local protection for their village. And he was from the village, he spoke the language, and he was trusted in a way that a foreign humanitarian organization was not. And trusted in a way that the actual military of Congo would not have been trusted in that case. And so, you know, these situations are much more complex, and we actually do need to take some time to understand the perspectives of local communities. It doesn't always have to be research with a capital R, like we did in this study, where we interviewed, you know, 90 different people across this context to understand what their perceptions were, but still it needs to have some basis in the actual perceptions of communities.
Anyone else want to add to that particular set of comments?
Yeah, just one quick, speaking about neutrality, I think it's very important for the military applying the principle of do not harm. So do not harm you apply through the analysis, understanding better. What do you understand? You understand basically the Maslow pyramid. So the hierarchy of need of a society, the hierarchy of need of a local community, which is not every time a pyramid. The shapes are very different around the world. And you can also have some reverse pyramids, like, for example, was very famous in Afghanistan. It was the opposite of the Western pyramid, where the community was the top part of the reverse pyramid. And then you need, I think somebody was saying today in the morning, to balance the urgency and imminence of the needs with the do not harm principle, in order to understand how much you can be flexible with the urgency, but also take some risks for the local communities or for the society in general terms, in order to help them, in order to give them the possibility to build on their own then their, let's say, future steps. Last but not least, we need to think that we need to use the DIME system, so the diplomatic, information, military, and economic. It's not only pure M, it's not only pure D, so it's not pertaining to both the words of the coin, but it's also a lot of E, economic, is also a lot of I, information. So how to manage information, how to drain from information the relevant things that we need, is what we need to apply to the planning process or to the way we understand a civilian environment, let's say.
Thank you. Yeah, very quickly, and then we move
very
to another
quickly.
question.
I come from a country where the military staged 13 coups in recent history of Thailand. So quite naturally, the general public does not trust the military whatsoever. And I'm talking about before the Thai-Cambodian conflict. Now they have become very popular again. But anyways, however, along the Thai-Myanmar border, the Royal Thai Army has been very popular. But one observation I like to make here is because people do not trust the police. And the people need somebody to cling onto, and that's the Thai military. Another small point is the Thai military along the border, they do recruit ethnic people. For example, there are some Karen soldiers in the Thai military as well. So that helps them to negotiate and mitigate with the local population.
Thank you. A second question I have, picking up on the presentations that you guys made, it's in relation to interoperability and also coordination. And the origin of my question is, in terms of the humanitarian world at the moment, you know, I already mentioned earlier that, you know, we really shouldn't be just talking about the UN, the Red Cross, and the NGOs. Now it is more communities of responders. So you have the non-governmental sector as a community, you have the private sector as another community, you have the diaspora community, you have the innovation community. A lot of these communities are multi-mandated and they overlap around the humanitarian enterprise. So in terms of both interoperability and coordination, let's go with coordination first. My question is, going forward, going into the next 5 years, my question is, who do we see as the coordinator of these communities of responders? Because when we look at the current situation, OCHA has been doing quite a bit of that up to this point. But we also know that with the restructuring, resizing of the UN, including OCHA, that OCHA's capability to be able to coordinate these increasingly larger numbers of communities of responders will be much less. And so I wonder if you have any comments, any of you have any comments about who could be doing the coordination? Would it fall to regional organizations such as ASEAN to be doing it? Well, Asia is very lucky in the sense that ASEAN is a very strong organization in this respect, but that is not necessarily the case. I cannot imagine that being the case in Africa, for example. In Europe, it's easier to think of it as the European Union as having, you know, that capability to do so. So here's my question: is kind of going forward, who would be doing the coordination? And then in terms of interoperability, if we're going to have more and more communities of responders, how do we actually get to interoperability? In procedures, in understanding, in any of the dimensions of interoperability that Piero was referring to. So if any of you would want to comment on that, any of that, that would be most welcome. So Eddie, you first.
I'll start with just the complexity of the world we face. And OCHA's got a part to play, and it absolutely has. But as you say, there is more of a regionalisation of challenges that we see. And you know, this region is a really good example of the amount of mini and multilateral organisations that exist already. And so I do think there's a version where we need to embrace some of those multilateral organisations and encourage them to take more of a regional approach. ASEAN is a great example. He had a centre inside of Singapore, you know, in Changi Naval Base, because I think that's the only way you're going to get to that level of interoperability that you talk to, and that is through things like tabletop exercises, understanding the environment you're in, And I go back to my own experience, working in the Combined Joint Task Force, we had the luxury of time to plan, to prepare. If you're trying to respond to a natural disaster, you don't have time. So what you do need to do is use forums and events like this to tabletop, to understand the environment, to build the trust that we've talked about on that last question, so that you do know how you can respond in a far more coherent manner. And that's the only way you can start to get interoperable, and then ideally reach up to some of the guiding principles that OJA can give us. But I think there is a more regional approach we need to take.
Thank you.
Yeah, thanks, Catherine. So very quickly, just to pick up on Eddie's point around tabletop exercises, and again, I understand this is a domestic solution in Australia, but it gives you an understanding of how we coordinate across multiple different agencies internally. As part of our preparedness framework, we run what's called a big map exercise. If you could imagine a basketball-sized cloth map of a local government authority in Australia, we run an event over 2 days. The first day is all of the agencies that might be involved: state government, local government, state emergency services, reconstruction authorities, the Red Cross, any number of other agencies are involved, and that's an opportunity for them to basically get their coordination right so that they understand how they would respond to a bushfire or to a flood or a cyclone in that local government authority area. And then the next day, we go through that process again with all the community groups and members of the local community involved. And that does two things. The first is that it allows the agencies to get their coordination right. We facilitate that under the direction of whoever the appointed authority is, local government, state government, federal government. So it gives the chance of that coordination. But the most important thing is it builds resilience, because what it does is it allows local community members and groups to identify if there's a bushfire and it starts there and it's burning in this direction, I now have faith that the Country Fire Service or the State Emergency Service or the ADF or Disaster Relief Australia is going to do those things. And also, for us as an organisation, what that does is it presents to the local community an alternative to the ADF. So if they see us running this activity, then the next question they then pose when the disaster happens is, well, where's Disaster Relief Australia? They're helping us to plan. We now understand what it's likely to look like. It gives us a level of resilience. We can go home and prepare ourselves better, but also when the time comes, we know who's going to come and help us out. So that's an example of what we do domestically, but I think in terms of how you achieve that, it's a large tabletop exercise that looks at a scenario and then works through what the solutions will be.
Thanks. Anybody else? Yeah, please.
Just a quick one. In terms of coordination, I think, so considering the big discussion about the UN role and, let's say, crisis that the newspapers are depicting at the moment, I think OCHA needs to maintain the lead in the coordination in general terms, because they are the expression of 196 nations all together under the same umbrella. It is perfect. It is not perfect. It is what we created in the last years since the Second World War, and I think we need to stick to this thing, which is precious. Regional organizations helps a lot. I come from Europe, and Europe as a European Union, like a sort of umbrella with different states reacting in different ways to the natural emergencies and natural disasters. In terms of interoperability, I think we need to involve more civilian presence in our meetings, in our TTX, in our exercises. As for example, here I'm not seeing the private companies, the enterprises, which are very powerful at the moment. Think at Elon Musk and Starlink and what he offers for the Ukraine peace. But also it helps a lot to refine the language, to share common knowledge, to understand the basics. And in this respect, to think together, to act together, to try to find a formula that works together. We have in MNCG, in Multinational CIMIC Group, we have a NATO CIMIC exercise we run every year. It's called Adaptive Interaction, and is a common forum where we have more or less 25 countries coming, usually. So it is an open door also for partners and non-partners to come and discuss and maybe train together and have an education program together. As well as we are able to export the education program and the training program around the world. So we are happy to receive any kind of possibility and offers, you know.
Thank you. Those are all great comments. Now, I'm looking at the clock, and actually, I've run out of time. I mean, in fact, I've gone over about 1 minute. So it's probably time to wrap up this discussion. I'm not going to try to summarize the discussion. Has just been too rich. But I'll give you my one takeaway from listening to both the presentations and the Q&A we just had. 30 years ago, when the Oslo guidelines were first promulgated, the general feeling at the time, we really felt it was humanitarian affairs should be civilian, and the militaries were treated as the interlopers. You stay in your lane, we'll stay in our lane, okay? And I think at this point, just from this discussion we've had, it's very obvious that we've now come to understand, I'm not going to use the condescending word, come to accept, we've now come to understand that we all each have, many of us have a role to play. And it's about how we play that role and how we play those roles together for the benefit of the people we want to serve. And I think that is real progress in the 3 decades since we had the Oslo guidelines. So that's my takeaway. I don't think that's a summary of our discussion. Anyway, thank you so much.